Your cat might be in serious trouble, and you won't even realize it until it's too late. Cats are experts at hiding pain and illness, and the smallest changes in their behavior could be urgent warning signs that something is terribly wrong. Many cat owners overlook these signals, but today I'm going to reveal 9 urgent cat warnings you should never ignore. Some of these might shock you, and if your cat is showing even one of them, you must act fast. So before we begin, like this video and subscribe to this channel to stay informed and keep your furry friend safe. Now let's dive into the first warning sign. You won't believe how important this one is. Let's start. Number 1. Sudden hiding for long hours. If your cat, who usually loves lounging in the open or interacting with you, suddenly starts disappearing for hours or even days, staying hidden under beds, inside closets, or behind furniture, it's a major red flag. Cats instinctively hide pain or illness, a survival trait from their wild ancestors. A cat that suddenly becomes invisible could be dealing with a serious issue. Anything from an injury, internal pain, or even a severe illness like kidney disease or an infection. This change is especially alarming if they refuse food or don't come out even when you call them with their favorite treat. They might also growl or hiss if disturbed, which is a cry for help, not aggression. Unlike their normal playful hiding, where they peek out or respond when called, this type of hiding is silent and withdrawn. If you notice your cat doing this, don't wait. Gently coax them out and check for any signs of distress. Then get them to a vet immediately. Number 2. Extreme vocal changes. A cat's meow is its way of communicating, and any drastic change in their usual sound could indicate trouble. If a normally quiet cat starts yowling loudly or a chatty cat suddenly falls silent, pay close attention. A deep, sorrowful yowl might signal pain, while a high-pitched, desperate cry could indicate anxiety or distress. Some cats develop a hoarse or raspy meow when they have throat infections or respiratory issues. Older cats that start yowling at night might be experiencing cognitive issues, similar to dementia in humans. If your cat starts meowing constantly in a way that sounds different from their usual tones, especially at odd hours, it could mean they are in severe discomfort, frightened, or even suffering from something as serious as organ failure. Sudden silence is just as concerning. If a talkative cat stops meowing entirely, it could be due to a throat tumor or extreme stress. Never ignore an unusual meow. It could be their only way of telling you they need help. Number 3. Refusing to eat for over 24 hours. A cat skipping a single meal might just be a picky mood or a reaction to a slight change in routine. But if they refuse to eat for an entire day, alarm bells should ring. Unlike humans, who can go for days without food, a cat's body starts breaking down fat within 24 hours of starvation, which can lead to a deadly condition called hepatic lipidosis, fatty liver disease. This can happen even faster in overweight cats. A loss of appetite might indicate anything from dental pain, an internal blockage, or even a deadly viral infection. If your cat sniffs its food, walks away, or shows interest but doesn't eat, watch closely. Check for signs of nausea, like lip licking or excessive swallowing. If they also stop drinking water, it becomes an emergency. Cats are masters at masking discomfort, so when they stop eating, it means something is seriously wrong. Never wait longer than a day to seek help. Early intervention could save their life. Number 4. Sudden aggression or fearfulness. A once loving cat that suddenly starts hissing, swatting, or even biting when touched is not just being moody. It's a serious signal that something is wrong. Cats don't lash out without reason. Pain, internal discomfort, or even neurological issues can trigger aggression. If a cat that used to love being petted suddenly reacts violently to touch, they could have an injury, arthritis, or a hidden illness. Fearful behavior, like jumping at every sound, running away from familiar people, or hiding excessively, could be a sign of high stress or even neurological damage. Sudden aggression in older cats can sometimes indicate cognitive decline or a brain tumor. Even if your cat isn't physically attacking, but suddenly seems scared of normal things, take it seriously. Look for any underlying medical issue before assuming it's just bad behavior. Number 5. Struggling to breathe or open mouth breathing. Cats should never breathe with an open mouth unless they are panting briefly after intense exercise in a hot environment. If your cat is gasping for air, breathing heavily, or has their mouth open while at rest, it's an emergency. Respiratory distress in cats is often caused by heart disease, lung infections, or even an obstruction in the throat. Some cats with asthma will suddenly start crouching low, breathing fast, and flaring their nostrils. If they seem to struggle to inhale or exhale, it could mean fluid is building up in their lungs, a life-threatening condition that requires immediate veterinary attention. Watch for subtle signs, like their sides moving rapidly or sitting in a strange position with their neck extended forward, as this is a desperate attempt to get more oxygen. If you ever see your cat breathing this way, drop everything and get them to a vet immediately. Number 6. Drastic weight loss or bloated belly. Cats' weight should remain relatively stable. A sudden drop in weight, even if they are eating well, can signal serious issues like hyperthyroidism, diabetes, or even cancer. If you start noticing their spine or ribs becoming prominent, or if they look bony despite eating, don't assume it's normal aging. It's a sign of trouble. On the other hand, a cat that develops a bloated belly while the rest of its body remains thin could have dangerous fluid buildup, parasites, or organ failure. Some conditions, like feline infectious peritonitis, FIP, cause fluid to fill the abdomen rapidly. If your cat's weight changes noticeably in either direction, it's time to act fast before the condition becomes irreversible. Number 7. Frequent vomiting or lethargy. Cats vomit occasionally. But if your cat starts vomiting multiple times in a day or every day for several days, it's not just a mild stomach upset. It could indicate poisoning, kidney failure, or an intestinal blockage. Chronic vomiting paired with lethargy, where your cat seems uninterested in play, food, or even interaction, means their body is struggling. Lethargy alone is a huge red flag because cats naturally hide weakness. If your cat lies around all day, doesn't react much to noises, and lacks energy, something is wrong internally. A cat that's throwing up frequently and then just lying around weakly needs immediate medical attention. Number 8. Unusual litter box habits. A cat straining to urinate, crying in pain, or producing only a few drops should be rushed to a vet. Male cats, in particular, can suffer from urinary blockages, which can be fatal within 24 hours. If they suddenly stop using the litter box or start going outside of it, they might have a bladder infection, kidney disease, or even emotional distress. Blood in the urine is an emergency sign that shouldn't be ignored. Even small changes, like going more often or with difficulty, mean there's something wrong inside. Number 9. Seizures, stumbling, or disorientation. If your cat suddenly collapses, twitches uncontrollably, or has difficulty walking straight, it could be a neurological issue. Seizures in cats can be caused by toxins, epilepsy, or brain damage. A cat that seems dizzy, confused, or has difficulty keeping balance may be experiencing a stroke or inner ear infection. If their pupils look uneven or they keep falling over, it's an immediate emergency. Neurological problems escalate quickly, so any sign of disorientation or sudden loss of control over their body needs urgent medical care. Cats are masters at hiding pain and illness, so when they show any unusual behavior, it's often a desperate signal that something is wrong. From sudden hiding to drastic weight changes, breathing difficulties, or aggressive behavior, these signs are not just quirks, they could mean life-threatening conditions. Ignoring these warnings could result in severe complications or even the loss of your beloved pet. The key to keeping your cat healthy is early action. If you notice any of these urgent warning signs, don't wait for them to get better on their own. Cats rely on us to recognize their silent cries for help. A quick trip to the vet could be the difference between a treatable issue and a fatal condition. Trust your instincts. When something seems off, act fast. Your cat's life could depend on how quickly you respond. We hope you enjoyed this video. If you did, please make sure to like it. We'll see you in the next video.